Hi, this is my subcutaneous injection video. I have on my name badge, my watch, my pen and pen light, my stethoscope, my hair is back, nails are trimmed, I have closed-toe shoes on, and I'm going to show you my area where I'm working. Okay. Alrighty, I'm walking into the bedroom, washing my hands. Alright, I'm now going to locate my MAR. So I have my MAR right here. Okay, so the MAR states patient name Abby Abdomen, date of birth 11/3/55, age 64, gender female, no known allergies, and the date today, April 19th, 2020, and the order is to administer NPH insulin 26 units subcutaneously stat. So now I'm going to select the correct vial, NPH insulin. So I have regular insulin and NPH, so of course selecting NPH. Alright, I'm going to check the dates to make sure the vial is not expired. If it was expired, then I will throw it out. Okay, so the factory expiration date is May 2027, so that is good. The written expiration date, so this vial was previously opened, and the date here is 30 days away from when the vial was originally opened, and that new expiration date is May 9th, 2020, so it is not expired. Now I'm going to perform my 6 rites. So I have, comparing with my vial here and my MAR, so I have the correct patient name, Abby Abdomen. I have the correct drug here, so NPH insulin, and the strength is 100 units per milliliter. I'm going to be administering 26 units, and the route is subcutaneously. The time is stat, so as soon as possible, and I will document later. Now I'm going to select my syringe. Alright, so I'm looking for an insulin-specific syringe, and I have that here. It's a 1 milliliter insulin safety syringe, and it's for use with U100 insulin only. And I am using U100 insulin. Okay, so now I'm going to write my medication label. Alright, looking at the MAR as well as the vial here. Okay, patient Abby Abdomen. Drug NPH insulin. Okay, amount 26 units. Okay, and I'm writing out units. So the date is 04/19/2020. The time right now, it is 9 p.m., so 2100. The expiration date, I'm going to use the factory expiration date, and that is, again, 05/2027. The route, subcutaneously, again, writing that out. Added by my initials, followed by my credentials, student nurse. Alright, patient name, Abby Abdomen. NPH insulin, 26 units. The date today, time 2100. Expiration date 05/2027. Subcutaneously, and my initials. Okay. Alrighty, so I'll put that on the syringe in a little bit. Now I'm gonna get the vial ready. So first I am going to roll the vial because I have NPH insulin. So making sure all the sediment on the bottom is mixed in well and leaves the solution cloudy. Okay, there's no sediment left on the bottom here, and it is nice and cloudy. Okay. Now I'm going to wipe the top of the vial for 15 seconds. Alright, starting now. Lots of friction, getting it nice and cleansed. Okay. So now that vial's ready, I'm going to open up the syringe, maintaining sterility. Okay. So I'm going to make sure that I'm maintaining sterility of the syringe. I'm not going to be touching the inside of the plunger here, and when the cap is off, I'm not going to be touching the hub as well. So first I'm going to draw back 26 units of air. So that is the third mark down. From the 20. Okay, so I have it on the third mark down, and I'm going to remove the cap. Maintaining sterility, I'm going to place it on its side. Now I'm going to inject the air, so bullseye, inject, and turn it over. So making sure that I'm not drawing up any bubbles, I'm going to use my light so that it's easier for me to see. Now I'm going to push back. Okay, checking for any bubbles. Okay, that looks good. So now I'm going to draw up to the 26 marking. Or push up. Okay, so the third mark down is there. I'm just going to do one more. Here. Okay, and I actually see a bubble here, so I'm going to do that again. We want no bubbles. going to give it a few flips with my pen here. Okay, see a bubble at the top and I'm going to push. Gonna get it. Okay. All right. No bubbles there. I'm going to push up to the marking. Okay. The third tick down, and I'm just going to check one more time. Okay, looks good. Now I'm going to recap maintaining sterility using the scoop method. I'm going to put on the label and making sure I'm not covering any marks on the syringe. I'm putting it up here, and I'm just going to have it like a flag. Okay, now I'm going to do my second round of 6 rights before I head to the patient's room. Okay, so comparing my MAR here with my syringe and my vial. Alright, I have the correct patient ABI abdomen. That is what I wrote down on the label here. The correct drug, so NPH insulin, and NPH insulin 100 units per milliliter here. And that's what I just used to draw up medication. So I have the correct amount, so 26 units, and I'm going to verify that here. Third mark down, 26 units, no bubbles. Alright, the route is subcutaneous. That's what I wrote. And the time is stat, and I will document later. Okay, now I'm going to get all my materials ready for my patient's room. So I'm bringing my MAR, my vial here, of course my syringe. I have an alcohol pad. This is my patient and the wristband. And I have gloves here. Okay, so everything is good. And I'm walking down to the patient's room. Entering the patient's room, I'm washing my hands nice and thoroughly. Now I'm going to introduce myself. Hi, my name's McKayla. I'm going to be your nurse today. How are you? I'm good. That's good to hear. Okay, making sure hands are nice and washed. Now I'm going to verify the patient's name, date of birth, and allergies. And I'm going to be doing that by looking at my MAR and referring to the patient's wristband, making sure that everything matches up. All right. Can you please tell me your name and date of birth? Yeah. It's Abby Abdomen. Okay. Date of birth, 11/3/55. All right. Checking those things match on her wristband and the MAR as well. And that reads Abby Abdomen, 11/3/55. All right, Abby, are you aware of any allergies? No allergies. Okay, looking at the wristband, no allergies, and the MAR also states no allergies. So Abby, today I'm going to be administering your medication of 26 units of NPH insulin into your abdomen. You're going to feel a light poke, but it shouldn't hurt. Please let me know if you do have any discomfort. Do you have any questions? No questions. Okay, now I'm going to perform my final 6 rites by the bedside table. And in a real life situation, I would make sure that all my supplies is at the bedside table and not on the patient's bed. So I have my MAR here, my syringe, and double checking with my vial as well. All right, I have the correct patient, so Abby Abdomen, and that is what I have on here, and she also just verified for me. I have the correct drug, NPH insulin, that's what's written on here, that's what I drew up, and NPH insulin on this vial here. All right, I have the correct amount, 26 units. 26 units is written out, and I'm going to verify with okay, and I have 26 units in the vial here. The route is subcutaneously, okay, and the time is stat, and I will document later. Now I'm going to show the instructor my syringe here with the label and the correct amount with no bubbles, and my vial here. Okay, I'm just going to move this forward because it will be easier to see. Okay, so there is my label. I'm going to engage the safety because it's easier to see. Okay, alright, so I'll show you that I have the correct amount. Okay, and no bubbles. Okay, now I'm going to engage the safety back, and I will show you the vial. So NPH insulin there, E100, and I have the expiration dates. Okay, that says EXP with the expiration date there and the manufacturer. Okay, so let's do that one more time. Alright, so now I can go ahead and I'll scoop this back. Alright, so I'm going to put on my gloves. Okay, so I have my gloves on. Now I'm going to locate my site of injection. So today I'm injecting, like I said, into the abdomen. And I'm going to make sure that I'm 2 inches away from the umbilicus and that I am not injecting at a site that has previously been injected into. Okay, so I have a site picked out and I'm going to go ahead and get my materials ready. So I'm going to open up my alcohol wipe. Okay, and I'm going to just loosen up the cap here. Okay. So put that down here. Okay. So now I'm going to bunch the abdomen and clean the site of injection, or clean around where I'm going to inject. Starting inwards, working way outwards in a circular motion. Okay, holding the bunch, gonna let this dry. Alrighty. Alright, so I'm gonna tell the patient that she's gonna feel a slight poke. So Abby, you're gonna feel a slight poke in just a second. Okay. And I'm gonna dart down at a 90-degree angle. Alright, Abby, you're gonna feel the poke. I'm going to inject the medication slowly. Okay, I'm going to hold for 5 seconds. 5, 4, 3, 2, 1. Letting go of the bunch and taking out the needle, engaging the safety, and putting it immediately into my sharps container. Alright, Abby, how was that? Oh, it was fine. Alright, I'm just going to dab around lightly. Any excess fluid. Okay, throw that away. Alright, Abby, so is there anything else I can do for you? No? Alright, I'm going to clean up. So here's your call light button. Press that if you have any, if you need anything. Alright, now I'm going to clean up my materials. Okay, taking off my gloves. Washing my hands. Leaving the patient's room. Alright, so washing my hands nice and thoroughly. Alright, so today I injected the subcutaneous injection into the patient's abdomen. However, there are other sites that you can administer subcutaneously, and that is the back of the upper arms here, the subscapular, the abdomen, like I said, the flank area, so your love handles, and your upper thigh. However, if you are administering heparin, you must administer it in the abdomen. That is all.